Good morning, and thank you all for being here today. Across the United States, cities are seeing an uptick in crime due to the coronavirus pandemic. Unfortunately, this trend is not exclusive to our community here in Baton Rouge. And while this may not be unique to our community, we cannot discount the impact it has on our people. The violence we have seen in our streets is unacceptable. We have seen how the story of violence plays out for the victim and for the accused. Lives are lost, and any future potential is ended. In 2018 and 2019, my office worked diligently to address the systemic issues of inequity that create the conditions where crimes happen the most. We developed programs like Recast that created healing circles for those affected by violence. Families on the front line of peace that connected with mothers who lost their sons to violence. And we increased opportunities for young people with the Mayor's Youth Workforce Experience. In those years, we saw reductions in crime, violent crime specifically, here in Baton Rouge. So what has changed in 2020? A global pandemic. Our response to COVID-19 is the same as our response to any other emergency that can undermine the growth of our community. We take a whole community approach where stakeholders from all sides come together to bring peace, prosperity, and progress. I cannot and I will not be silent about what we see happening. Baton Rouge, enough is enough. To those who seek to disrupt the peace of our community with senseless violence, let this be a warning. We will seek justice. We have an obligation to do so. As mayor, I also have an obligation to empower residents of disinvested communities to work directly with me and key stakeholders to strengthen public safety by addressing the social, economic, and environmental conditions that are linked to crime. The future of Baton Rouge depends on us, on all of us joining together to address this issue head on. We must recognize the moment we are in and respond to it with strategic decisions that address the immediate issue, but give us a long-term strategy to being a healthy community. We know that violence at its core is induced by a number of factors. We know crime is more likely to occur when people are unable to meet their most basic needs, an education, a stable income, transportation, or access to nutritious food and health care. The only way for us to move forward is to take a comprehensive, all-encompassing approach to address the issues facing our community. I gathered all of you all here today to announce our next steps in our mission to create a safe, hopeful, and healthy Baton Rouge. My administration will dedicate $2.5 million allocated to Baton Rouge through CARES Act funding to interrupt the cycle of violence, to strengthen family support, to revitalize neighborhoods, to promote academic education, and prioritize access to care. So the Safe, Hopeful, Healthy strategy will target our youth through mentorship programs, connect our residents to all of the social services and benefits the city parish has to offer. It will improve the opportunities available within the community through youth development programs and connect our residents to neighborhood-based public benefits and support services. In addition to this, we will address the ongoing cycle of violence by engaging credible messengers directly from the 70805 and 70802 zip codes, the areas where we are seeing the highest rate of violence. It is vital that we see value in the live experiences and expertise of people in their pockets of the community, including those previously involved in violence. All of these efforts will be informed by data from the Baton Rouge Police Department and from public health. Safe, Hopeful, and Healthy will use analytics to determine what segments of our community will have the greatest benefit from this programming. This will allow us to maximize the resources we have available to us. I would like to allow key stakeholders at this moment in this project to share insight on how Safe, Hopeful, and Healthy BR will impact our community. First, we will have Coletta Barrett of Our Lady of the Lake Healthcare, followed by John D'Angelo of Investor Bank.
Thank you, Mayor Broom. Our Lady of the Lake Regional Medical Center, Our Lady of the Lake Children's Hospital, is a committed partner to addressing violence as a public health issue. We have participated and supported health centers and schools for the last 15 years or so. In 1984, a vision of bringing health to the schools itself, where children are on a daily basis, was envisioned with creating health centers and schools. At this point in time, we provide care to 42,000 children in our public school system in 92 separate buildings across our parish. That's a daunting approach to how you can serve children. As a result, we have created what's called integrated health care, where mental health, social workers working with nurses and school health assistants in our schools address children. It's not enough. While we have implemented and educated on ACEs, adverse childhood experiences, and how that shapes how young children look at their lives, it's still not enough. So in partnering with the mayor's office and being able to extend the work that's already been started with health centers and schools, we look forward to augmenting that work in junior highs and high schools across our community to better understand the impact of violence in those households, to be able to link the families to the services that they need, using the children or having the children bring us into their family. We then will be able to take a holistic approach, not just to the one child into the school, but maybe the 3 or 4 brothers and sisters that are in the room and the family as a whole. We look forward to working with the mayor's office and making sure that we continue to have a community that is safe, hopeful, and for us, healthy.
Thank you.
Mayor, I just want to say thank you for the leadership. I believe that without this type of leadership and without these types of programs, we cannot embark upon change. And we need change, and I'm proud to be a part of it. I just want to briefly speak about the micro grant program that we had initiated a few weeks ago. Already we have 300 applicants, and we're most proud of that. We've distributed to 22 businesses, and the biggest holdup for us is getting them to complete their tax returns, and it's completely understood in a pandemic it's been difficult for that to occur. But the program is off and running, and we think a program like this micro grant program will really be able to put money back into our community and help small businesses to continue to thrive and move forward. Mayor, thank you again for this.
Thank you. Our community cannot afford to shy away from difficult conversations, especially those surrounding public safety. The first pillar of our Safe, Hopeful, and Healthy program is to prioritize community-based public safety. In the next 30 days, our Office of Community Development will work with national partners from Cities United and Annie E. Casey Foundation to join cities like Atlanta, Baltimore, and Newark to engage violence interventionists in our community. The second pillar is stabilizing youth, family, and community. This means empowering individuals in low and moderate income neighborhoods to aid people in their community to access resources and other needs. These individuals will be trained to provide services such as help with SNAP and WIC applications, advocate for families and individuals in health settings, and other needs for a family or individuals. There will also be school-based outreach programs that provide wraparound services to parents in low and moderate income areas. This outreach will employ community health workers in high schools and middle schools to assist parents who are unable to provide quality care for their children. The third pillar is expanding health in all policies. Our stakeholders in the health space will work with us to address violence and racial disparities through the public health lens. And the fourth pillar is creating equitable community development. Through a neighborhood-centered strategy, the Resident Leadership Program will be made up of 25 emerging resident leaders who show a demonstrated interest in leading neighborhood change. The program will recruit 5 low to moderate income residents from each of the 5 targeted disinvested neighborhoods to form cohorts. The Mid-City Redevelopment Alliance will then lead and facilitate the training for the 5 neighborhood cohorts. I look forward to seeing how we can all join together to create substantive and transformative progress in East Baton Rouge Parish. Thank you to all our stakeholders. Thank you to all the community members who have been working today to come up with a plan of action prior to this press conference. And so now I'll take any questions that you might have. Yes?
So is there any in particular areas that you're going to want to focus on first that appear to be more violent than other areas right now?
We do know that according to our chief and law enforcement officials, that 70805 and 70802 will be targeted areas. But as you heard in my comments, we have to focus on areas of disinvestment.
Could you tell me how this program is different from the ones you tried in the past? Violence continues to rise in this area. How is this program different?
Yeah, well, first of all, I don't know about all the programs that we've had in the past that are like this program where we have 4 pillars. But I will tell you one of the differences is the fact that we are in a different environment, And the truth of the matter is, as you heard me say in my statements earlier, we were on a trajectory of decreasing our number of violent crimes in our community in 2018 and 2019. Our numbers were decreasing. So what happened different in 2020? We all know, a global pandemic. And if you look at the history of violent crime in our community, we also had an uptick when? In 2016, another year of trauma. So many of the pieces of the puzzle that we've had with law enforcement going out in the community, they could not do that through their community policing because of the pandemic. So those are 2 distinct situations that have happened. This program is different in that we are using different tools, such as interventionists who will be going out in the community, such as resident leaders who will be trained to address issues in their community, and in addition, the funding. We have 4 pillars that we're focusing on, and that also contributes to the individuality of this particular program. Yes?
Do you happen to know how many people are going to take this program?
First of all, the program will be rolled out for our community partners to become a part of it through an RFP process. And then from there, the program will be based on data and research in terms of how it will be continued to be implemented in the community. So I can't put a number on how many people will be impacted, but I assure you it's more than what is taking place at the present time. Any other questions?
Just tell me how this program qualifies for the CARE Act funding.
Okay, very good. So this program, as I said earlier, has been funded and is part of a COVID response. So now HUD has increased the public service cap on some of our dollars, meaning that we can spend more money this year on outreach and programming. Traditionally, it's 10%. Now, because of the COVID environment, is up to 100%. So the key factor in being able to transform and utilize dollars in a broader sense is due to COVID-19. Yes.
So why do we need this program, especially right now, at this time?
Well, as I shared earlier in the beginning, we have seen an uptick in crime. Chief Paul and I and other law enforcement and community members have had conversations on what are some of the reasons behind the uptick in crime. But in addition to that, we've also had conversations with what will be the strategy to address this uptick in a COVID-19 environment, certainly apart from the work that law enforcement is doing. And we recognize, as I shared with many of these community members earlier, Baton Rouge Police Department can't solve it all. Government can't solve it all. In order to have an effective formula to address this uptick, we have to have a variety of stakeholders at the table. And the truth be told, some of the best results of intervention happen when the community is directly involved, and that the ideas come from the community as well.
Any other questions?
Thank you all for coming out today, and we look forward to what will be happening in the future as we implement this program. Thank you all so much.